What if you suddenly started losing time? One moment you're out with your family, and the next you're waking up totally confused with no memory of what just happened. This isn't a scene from a movie, it was the terrifying reality for the popular YouTuber Nate the Lawyer. He started having sudden blackouts, debilitating headaches, and episodes of confusion that all signaled something was profoundly wrong. His journey began with what could have been mistaken for a simple fainting episode, but quickly spiraled into a medical emergency that revealed a massive tumor hidden inside his skull. When we hear brain tumor, our minds often jump to the worst case scenarios. But the world of neurology is incredibly complex. Not all brain tumors are the same, and a person's specific symptoms are the critical clues that point doctors toward a diagnosis. In this video, we're going to break down the specific medical pattern that Nate the Lawyer's case fits. We'll explore why his symptoms pointed not to a hormonal issue or a common migraine, but to a classic case of a tumor causing immense physical pressure on the brain. And we'll contrast it with other types of brain tumors, from the more common to the highly malignant, to show just how much the right diagnosis can change everything. The symptoms of a brain under siege. The story Nate shared with the world was alarming. It wasn't a slow, gradual decline, it was a cascade of frightening neurological events. He reported sudden fainting spells, confusion, and memory lapses. These weren't just feelings of being off, these were signs that his brain's fundamental wiring was being disrupted. While headaches are a common symptom of brain tumors, Nate's were accompanied by other red flag symptoms. As the pressure in his skull mounted, more appeared, including vision difficulties and even seizures, which are essentially uncontrolled electrical storms in the brain. Online speculation was rampant, but in medicine, you follow the evidence. A key step is differentiating these symptoms from more common issues. For instance, a classic migraine is an intermittent event. People typically feel perfectly fine between attacks. While intensely painful, a classic migraine usually involves throbbing pain on one side of the head, nausea, and severe sensitivity to light and sound. Some people also experience what's known as an aura before the headache begins. Temporary visual disturbances like seeing flashing lights, zigzag lines, or blind spots. But migraines do not typically cause the kind of complete blackouts, significant memory lapses, or seizures Nate was experiencing. Headaches from a tumor often worsen over time, can be more severe in the morning, and are accompanied by other neurological signs. Nate's combination of symptoms, the fainting, confusion, and seizures, didn't point to a typical headache. They screamed of a structural issue. Something was physically compressing, squeezing, and irritating the brain itself. This is a pattern known as mass effect. It's what happens when a tumor gets big enough to displace brain tissue, block fluid pathways, and crank up the pressure inside the rigid confines of the skull. Nate's symptoms were a direct result of his brain being under siege from this growing mass. After a CT scan and an MRI, the culprit was identified. Nate's diagnosis was a meningioma. This is a crucial distinction. A meningioma isn't technically a tumor of the brain, it's a tumor that grows from the meninges, the protective layers of tissue covering the brain and spinal cord. The vast majority of meningiomas, around 90%, are benign, meaning they aren't cancerous and typically grow slowly. This is fundamentally different from a malignant tumor like a glioblastoma or anaplastic astrocytoma. Those tumors arise from the brain's supporting glial cells and are highly aggressive. They grow rapidly and, most critically, they infiltrate brain tissue with finger-like projections, making them destructive and nearly impossible to remove completely. A meningioma, by contrast, usually just compresses the brain. Think of it this way. If your brain is a pillow, a glioblastoma grows from the stuffing and spreads through it. A meningioma is like a rock being pressed against the pillowcase, squashing the pillow underneath. The tumor itself is separate from the brain tissue, which is good news, but as it grows, its sheer size creates devastating consequences. Nate described his tumor as massive, and the images he shared confirmed it. This large mass was the source of the immense pressure or mass effect that was causing his neurological systems to fail. Pressure on the frontal or temporal lobes can lead to confusion, personality changes, and seizures, which lines up perfectly with what Nate was experiencing. The surgical solution, a craniotomy. When you have a large symptomatic meningioma causing significant mass effect, there's really only one primary course of action: surgery to remove it. The goal is to debulk the tumor and relieve that dangerous pressure on the brain. The procedure for a meningioma like Nate is a craniotomy, major open brain surgery. A neurosurgeon makes an incision in the scalp, removes a piece of the skull to access the brain, and then meticulously works to separate the tumor from the delicate brain tissue it's been compressing. After a grueling 12-hour surgery, his surgeons were able to remove 90% of the mass, a tremendous success. The reason they couldn't get 100% is common in these cases. Sometimes the tumor is attached to critical blood vessels or nerves that, if damaged, could cause a stroke or permanent disability. Leaving a small benign remnant behind is much safer than risking a major neurological deficit. This approach is possible because the meningioma is distinct from the brain. For an infiltrative tumor like a glioblastoma, the goal is also to remove as much as possible, but complete removal is rarely achievable because the cancer cells spread into healthy tissue. Understanding these medical distinctions is so important. If you're finding this breakdown helpful, take a moment to subscribe. We're all about demystifying medicine behind chronic pain and other pain disorders, including acute pain, and help you grow in your understanding to make sense of your chronic pain struggle. Now let's explore a different path. Another common type of benign brain tumor is a prolactinoma, but its medical pattern is completely different from Nate's. A prolactinoma is a tumor of the pituitary gland, the body's master gland at the base of the brain that controls many hormones. Unlike a meningioma that causes problems with physical pressure, a prolactinoma causes problems by overproducing the hormone prolactin. Its symptoms are neither the severe neurological pressure signs seen with a large meningioma, nor the rapid decline associated with a glioblastoma. Instead, they're hormonal. In women, this can lead to irregular periods and milky breast discharge when not pregnant. In men, symptoms often include loss of libido, erectile dysfunction, and sometimes breast enlargement. These issues are a direct result of the hormonal chaos the tumor creates. Because a prolactinoma is a functional hormone-secreting tumor, the first-line treatment usually is medication. A class of drugs called dopamine agonists is incredibly effective at shrinking these tumors and bringing prolactin levels back to normal. For most patients, the tumor shrinks and symptoms resolve, all without a single incision. When I first heard Nate's case, I suspected he may have had this because they gave him medicine to shrink the tumor, but under further consideration, the medicine he probably received was dexamethasone, which is a steroid that helps reduce swelling. When surgery is needed for a pituitary tumor, it's also starkly different. The preferred method is a minimally invasive technique called transsphenoidal surgery, where surgeons go through the nose and sinus cavity to remove the tumor without opening the skull. Compare that to the major craniotomy Nate underwent. The medical patterns are complete opposites: hormonal symptoms versus neurological symptoms, medication first versus immediate surgery, a minimally invasive approach through the nose versus a major open skull operation. Nate's case simply didn't fit the prolactinoma pattern. So the medical pattern that Nate the lawyer's case fits so perfectly is that of a large meningioma causing severe neurological symptoms through mass effect. His story is a powerful illustration that brain tumor is not a single diagnosis. The tumor's location, origin, and behavior dictate everything. Nate's headaches and blackouts were not signs of a simple migraine. They were red flags for a structural problem inside the skull. His diagnosis of a meningioma meant his problem was one of physical compression, requiring a physical solution, a complex craniotomy. This stands in stark contrast to a malignant infiltrative tumor like a glioblastoma, which grows into the brain and carries a much graver prognosis. It's also completely different from a functional tumor like a prolactinoma, which causes hormonal issues often corrected with medication alone. Nate's public journey through this terrifying ordeal has not only rallied incredible support, but also has been a profound educational opportunity. It reminds us of the brain's fragility, the incredible skill of neurosurgeons, and how critical it is to understand the precise medical pattern behind a diagnosis. It shows that even with a frightening diagnosis like a massive brain tumor, there is often a clear path forward and real hope for recovery. Thank you for joining me for this deep dive. If you learned something today, please hit that like button and share your thoughts in the comments below. Stay curious and stay well.